Hey there, I'm Rob, the registered nurse who'll be walking you through this training today. I'll tell you a little bit about tobacco use in the United States and the role that we in the clinical care team play. Then, you'll see various scenarios between a few key players, including the medical assistant, provider, and patient, along with learning about the importance of asking, advising, and referring patients. You'll be trained on how to use the main sections of the tobacco intervention template. So, to start us off, did you know? Every year, tobacco kills more Americans than do AIDS, homicide, vehicular accidents, suicide, drug use, and alcohol combined. In the U.S., smoking is responsible for about 1 in 5 deaths annually. That's approximately 443,000 people who die per year because of smoking. Additionally, an estimated 49,000, or 11% of these smoking-related deaths, are the result of secondhand smoke exposure. In Texas, 19.2% of the adult population is a current smoker. That's more than 3 million people. And over 24,000 die as a result every year. Did you also know? We all have a vital role to play in helping people quit tobacco. Brief advice about smoking cessation can increase the chance of quitting by 66%. And yet, why is it hard for health professionals to talk with patients about tobacco use? Because it's tough. Judging by this conversation during the morning huddle between Dr. Bailey and the medical assistant Sue, there are several things that make it really tough. But there are also several things that make it really easy and effective.
Hey, Dr. Bailey. At your 10 o'clock hour, Mr. Martinez will be here for his diabetes follow-up. But on the schedule, it looks like he's going to want to talk about his back pain, too. Oh, I just don't have that much time. I'm already double booked. Yeah, that appointment's going to be tight then, because he's a tobacco user, too. So we'll need to address that as well. Yeah, I know. But I've talked to him before. We talk about it at every visit. I know, right? But if we don't bring it up every time, he won't think it's a big deal. Trust me. I'm sure Mr. Martinez would appreciate us asking him about his tobacco use. Well, he does get frustrated every time I bring it up. But I have read studies that say even just 2 minutes of brief advice can help motivate patients to think about quitting. You know what, Dr. Bailey? I remember you telling me that it can also take up to 7 times to quit. Let's see if he's ready to be referred to the Quitline.
Referral to the Quitline is super easy using the eTobacco protocol. It's built into your electronic health record, or EHR. An electronic health record is an electronic tool to help healthcare providers simplify the patient's intake process. The eTobacco protocol template lets clinicians refer tobacco users to the Quitline following an ask, advise, refer framework. The actual template pages might look different depending on the type of EHR software your system provides. First, let's go through what the intake part of the template might look like for a patient like Mr. Martinez. This first screen shows us that there's an option for reviewing and updating the patient's smoking status. Here we can record information such as the type of tobacco product used and how much the patient smokes. Once we know that the patient is a current smoker, we can use the eTobacco template. The template allows us to indicate whether the patient is ready and willing to quit, whether the patient consents for referral to the Quitline, and whether counseling has been given or discussed. This screen shows us that we can use the eTobacco protocol to make a referral for our patient. If the patient wants to be referred, this screen will allow us to determine the best time for the patient to be contacted by the Quitline. If the physician decides it's appropriate to provide prescription nicotine replacement therapy, there's a tab labeled medication that will allow her or him to do so.
So, Mr. Martinez, I know that you're here to talk about your diabetes, but let me first update our records. I see you've told us before that you're a smoker. Is that still the case?
Yeah, I am.
All right, let's talk about your smoking, Mr. Martinez. How do you feel? Do you think you're ready to quit?
I think about it all the time, but it's too hard on my own.
I completely understand that. But have you ever been part of any tobacco counseling programs? A quit coach could actually make a difference this time.
A quit coach? Wow. That sounds too expensive.
Well, actually, it's all free. If I can make a referral to the Quitline, you can get some help and support to become successful.
Ooh. Okay. How do we do that? So, let the patient know that the Quitline is a free, phone-based service that is also available online. It provides multiple one-on-one counseling sessions that come with the Quit Coach. Patients can also call whenever they're having cravings, 24 hours a day, 7 days a week. They can also get at least 2 weeks of free nicotine replacement therapy. And the Quitline even provides information about support programs available within the patient's community. So now, let's get back to the exam room and see how the MA talks with Mr. Martinez.
Is it okay for the Quitline to contact you?
Yes, that's fine.
Great. Now you can look forward to the Quitline calling you within the next 3 days to get you enrolled. So it's really important that you answer their phone call. And if you miss a phone call, remember to call the Quitline back.
Okay, I'll make sure to do that. And now, Dr. Bailey will get a chance to talk with Mr. Martinez using the tobacco intervention template. So, what can she or any other provider do if the patient is in fact ready to quit? In many EHRs, the provider will first see an alert that indicates his patient is an active smoker who is ready to quit and wants to be referred to the Quitline. If your EHR doesn't provide an alert, be sure to find out where required tobacco status is documented. It could be someplace like the patient's social history. Let's see how Dr. Bailey approaches Mr. Martinez with this information.
So, Mr. Martinez, I see that you're ready to quit?
Yeah, I guess.
That's fantastic! Woohoo! Have you tried to quit before?
Yeah, I've tried to go cold turkey, but haven't been able to quit completely.
That makes sense. It usually takes 5 to 7 tries for someone to quit.
Yeah, but come to think of it, I probably have tried that many times. It's always back and forth, you know?
Well, research shows that people who use nicotine replacement therapy have more successful quit attempts.
What's that? Do you mean like nicotine gum or something?
Yep, that's exactly right, like nicotine gum and the patch. Those are pretty popular.
Oh yeah, I've used nicotine gum before, and even that didn't work.
Yeah, unfortunately, we find some people don't use nicotine replacement therapy correctly, usually because they don't take it long enough. But I see here that you wanted to be referred to the Quitline. They can make sure that you're using everything correctly. Also, they provide great counseling to help you manage your cravings.
Okay, Doc. I trust you. Okay, so many of us might be thinking that patients' visits don't all work out so well. For instance, what if the patient says, no, they're not ready to quit? Keep in mind, any member of the clinical care team can face this situation. In the role play you're about to see, Dr. Bailey knows through way of an alert or a clinic-specific method that Mr. Martinez is an active smoker who is not ready to quit. This is what can happen in that case. I'm not really ready to quit. I just can't do it.
Okay, I hear you, Mr. Martinez. Do you mind telling me why you're not ready?
Well, I'm under a lot of stress, you know? I'm taking so many meds for my diabetes, so the smoking really helps me control all the stress.
I can understand why you feel that way. It must be hard managing the diabetes. But smoking actually causes more stress on your body. The nicotine from smoking actually increases your blood pressure and your blood sugar levels. I would really encourage you to start taking non-smoking breaks. Do something besides smoking that helps you de-stress. What are some things that you like doing for relaxation?
Well, I really like to go on long walks by the lake, especially with my wife. She thinks it's really romantic.
That's great, Mr. Martinez. I'm all for romance. And I'm very happy to hear you have other healthy things that can help you with your stress. When you get cravings, try and focus on other things that you enjoy. I think you'll start to feel better, like you can enjoy a life without cigarettes. We'll talk again during your next visit, and maybe you'll be ready to consider quitting then. We've got some great tools to help when you are ready.
Wow, Dr. Bailey did a great job handling that, didn't she? Now, let's consider. What if the patients want to quit but don't want to be referred at all? One of the best resources for a patient who might not be ready to quit is the yesquit.org website. A provider can easily direct a patient to this web-based source of information with no commitment. The provider can also talk with the patient about other treatment options, like prescription nicotine replacement therapy, or over-the-counter options like nicotine gum or the patch. Remember, you're a vital part of the patient's quitting process. If your patient smokes or uses tobacco, please motivate your patient to quit. Discuss the risks of tobacco use and the benefits of cessation, especially as they relate to the reason for the patient's visit, like Mr. Martinez's diabetes. And finally, remember to address tobacco use at every visit. With the help of the Tobacco Intervention Template, we're one step closer to reducing readmission rates. EHRs can make assessing patients' tobacco cessation needs as easy as possible if the eTobacco template is integrated in your system. But remember, not all EHR programs are the same, and some may require timely updates. Be sure the eTobacco templates are maintained at each system update. Now we know how to use the Tobacco Intervention Template, and we're ready to
Ask, advise,
and refer our patients at every visit.
Woohoo!